Alternative medicine and children. Am I talking about herbal remedies for kids? Yes. Currently, education regarding the treatment of causation, not just the symptoms, for children is sorely lacking. Almost all of the alternative education is either not readily accessible or focused on the adult patient. For the rare physician who wishes to indeed help their patient with minimal conventional medications, the challenge is daunting. There have only recently been a few pediatric physicians willing to consider and occasionally practice non-conventional or alternative medicine. Medical director and developer Dr. Eric Ryland graduated from the University of Miami in 1974 and completed his pediatric training at the University of Miami affiliated hospitals in 1981. He is pediatric board certified by the American Board of Pediatrics. During his 25 years of clinical experience, Dr. Ryland has researched and studied the holistic field and alternative treatments. What traditional medicine fails to recognize is that the immune system, competent to conquer the vast majority of infections on its own, is undermined by the use of antibiotics. This is because these drugs are used to treat the infection instead of allowing the body's natural defenses to combat it. Antibiotics dramatically reduce the population of healthy bacteria, which is a necessary part of a properly functioning immune system. Avoiding unnecessary antibiotics can end the vicious cycle of antibiotic abuse and repetitive infections. The pharmaceutical companies continue to produce and market stronger medications for those situations that commonly confront children, mostly because the milder drugs eventually have a progressively decreasing effectiveness. The bacteria have largely become resistant to the milder antibiotics, which since have largely been replaced by stronger and more potentially serious antibiotics, which are now necessary to combat the bacteria in both the mild and more serious infections. At times, these bacteria have even become resistant to all known antibiotics. The problem is compounded by a medical care system largely paid for by insurance companies that reimburse poorly, which induces a well-intentioned physician to cut corners, making office visits as brief as possible in order to keep their offices open and pay all expenses. Even if he or she would know how to approach the situation and condition and look for the underlying cause, there often simply isn't enough time. 6% of school-aged children and up to 3% of preschool children are consuming a daily dose of one or more medications because of their inability to properly behave, learn, and integrate into our educational system. At the same time, schools are serving and vending nutritionally inadequate snacks. Children often cannot function because of their improper and inadequate diet, nutritional deficiencies, widespread digestive disorders, and overloaded detoxification and endocrine systems. Often, the solution is as simple as correcting blood sugar, thyroid conditions, or giving nutritional supplements. Drugs are at best a temporary solution, not a permanent answer. As a matter of fact, researchers found that millions of American children under the age of 11, particularly African American and Hispanic children, may get too little vitamin D. The researchers suggested that all children take vitamin D supplements because of the generally low levels they found and the potential health benefits of boosting vitamin D to normal levels. The pediatrician, unlike any other physician, is in the position to begin life in a positive drug-free manner. Begin with proper diet and environment and then consider what effects recommended chemicals and medications may have. Keep in mind that these medications come from plants, come from other things that children may be allergic to, so that is something you should keep in mind as well. I encourage all parents to educate themselves and make informed choices for their child's health care. After all, you are your child's first doctor.